Lesbian couples, in order to have a family, obviously need sperm. And most of them will get sperm in an anonymous fashion from a sperm bank. Some will choose a known donor, also known as a directed donor. Going through a sperm bank is certainly less complicated since many of the legal issues and many of the medical issues have already been addressed by the sperm bank. All sperm donors have to follow ASRM guidelines in terms of screening for STDs, in terms of screening for certain genetic diseases such as cystic fibrosis, and obviously too they have to have a normal semen analysis. For many, many decades, by following these important guidelines, no one has transmitted hepatitis or HIV. So that's why it's critical to work with a good sperm bank and a reputable sperm bank. There are also some sperm banks around the country that are not very receptive to lesbian couples. And so we obviously try to steer the couples away from them and use some of the ones that we know are going to be very friendly to them. Some couples will choose to use a known donor, a directed donor. And about the only clear advantage of that is it's less costly because the sperm donor doesn't usually charge them. It's usually someone that they know, or it could be a relative of one of the women. What I try to do also, if I have someone that's using a known sperm donor, we insist on them doing counseling with our counselors to really discuss all of the ramifications, but also to have the three of them discuss how much interaction is the sperm donor going to have with the child or with the children. That's got to be hammered out, and it's got to be something that they're in agreement. And then, of course, there's the other side of it, which is the legal side, where they have to draw up some very solid legal contracts so that there's no problems long-term with the child's outcome.